vlog. It's Sabrina, your girl, and we are back with another how-to video about Tylenol. I'm so excited to share this with you today, but before we get started, please like, subscribe, comment down below on what video you want to see next, and turn on those bell notifications. So today, girls, we're going to be talking about Tylenol. Our Tylenol is one of the drugs we use every single day in the ER, and it's pretty much like Toradol. It's so easy to use, helps our patients out so much, and it's just one of those just helpful drugs that we need a little bit to know about. Okay, so I'm going to tell you all about it. So we use Tylenol just like we use Toradol, just like we used Dilaudid, gabapentin for those old little neuropathy patients, okay? So the generic name is Tylenol, also known as acetaminophen. It is in the class of analgesics, or it's an antipyretic, so also meaning it's an NSAID, okay? So we're going to talk about the mechanism of action today, the indications of when to use it, our contraindications, our side effects, our dosages, and our packaging. Look how cute! And any special considerations. Let's dive into it, okay? So the mechanism of action, let's talk about it. This is a pain reliever. That's pretty much all it is. Alleviates the pain in the threshold in the CNS system and acts upon the hypothalamic thermoregulatory center in our brain, okay? So girls, what that just means is that it's super important, okay? So some indications for when to use it. So you know when you're charting away and you're charting about when your patient came in, what they look like, all those demographics, you're going to be charting their pain level, right? So we give this drug in any mild to moderate pain, so 1 to 5. Girls, if you know, you know, okay? We want to make sure that it is pain where the medication is indicated, okay? So abdominal pain, headache, elbow pain, okay? Girls, if you are in pain, or your patient's in pain, you know, you want to make sure that you use it, okay? Some side effects: dizziness, lethargy, nausea, vomiting, okay? Abdominal pain, diarrhea, diaphoresis, chills, so any pretty much flu-like symptoms, those are going to be some of the side effects of it. But we need to understand that, are they having those side effects before or after? You know, it's super important that we understand that, and make sure you're documenting that. Chart, okay? So for our dosages, as you can see on the packaging, okay, it comes in 1,000 milligrams. Girls, if you're a math girly like me, you know that that's 1 gram, okay? So it's 1,000 milligrams or 1 gram in a 100 ml bag, okay? For our adults, we want to give 1 gram, 1 bag, over 15 minutes, infused over 15 minutes IV. This is not an IM, not a mouth. You do not drink it, okay? Over 15 minutes, it's single dose only, okay? For our pediatrics, we want to give 15 milligrams per kilogram over 15 minutes as well, to a max of 1 gram, okay? 1. Not 2, 1. Okay, and the packaging, again, like I said, is going to be 1,000 milligrams or 1 gram, okay, in a 100 ml bag. Contraindications are going to be those patients that are hypersensitive to it, okay, or any children under 2. We do not give IV Tylenol to, okay? And that's pretty much it. Thank you for watching today's video. I really want to share a story with you that's near and dear to my heart about my grandpa who had Tylenol. He wants to share his story about how he was in the ER with severe abdominal pain, and this saved his life. All right, let's get into it.
Howdy, partners. My name is Jerry Joe, and that's my horse Phineas behind me. And my daughter, my granddaughter, my daughter's daughter, which is my granddaughter, her name's Sabrina. I'm sure you met her before. She's so cute. She told me to tell you about my experience with abdominal pain about 3 weeks ago. Worst experience of my life. But I'm here to tell you that I survived. We're going to head into the story. It's a good one. And I'll give you a spoiler alert. All I had to do was take a poo. So back around about 3 weeks ago, I was laying in bed watching horse racing. That's my noble steed back there,
Phineas, and I was horse racing. I was watching a horse racing, I'm sorry. And I was laying in bed, and all of a sudden, out of nowhere, excruciating, 10 out of 10, right in this region, abdominal pain. Well, I'm a tough cookie. I've survived at least 2 world wars, a drought, bombings, you name it, I've survived it. Tick infestations, lice. Well, this was unlike anything I've ever experienced before. So horrific pain. So I called my granddaughter, Sabrina. I'm sure you met her. She's so pretty. And she said go to the hospital. So I did. So I'm laying in a hospital bed. Can't move, cannot breathe. And they come along and they say, what's your pain? And I'm a manly man, right? I ride horses, okay? I'm a manly man, and I said, my pain's a 5, even though it was like a 13 out of 20. And they said they'd give me, you know it, Tylenol. Yes. So I lay there. They pricked me 87 times because they can't get an IV in my arm, stupid nurses. And they finally get an IV in me, and they give me Tylenol. And it helps a lot. It really does. My pain's gone. It only lasts for about 15 minutes, but it's gone. And it worked, and thank the good Lord, I'm still alive here today with my horse, Phineas. Phineas loves pickles. So yes, that's my story. Sabrina wanted me to tell you it works. So please, if you know anyone, recommend. Highly recommend. Okay, have a good day, y'all. Bye.